What is a traumatic brain injury? Traumatic brain injury, TBI, represents a lesion that disrupts the normal functioning of the brain. It can be caused by a blow, a bump, or a penetrating head injury. External forces that might cause a TBI include gunshot wounds to the head, car accidents, or falls. The main causes of mild brain injuries are falls in 47% of cases, followed by being hit by an object, and car crashes. The commonly accepted criteria established by the TBI model systems to identify the presence and severity of a TBI include damage to brain tissue that is caused by an external force or at least one of the following: amnesia, a documented loss of consciousness, abnormal brain scan, skull fracture, or a post-traumatic seizure. Types of injuries: closed versus open head injury. During a closed injury, the skull and brain contents have not been penetrated, for example, during a motor vehicle crash. The damage occurs because the person's head stops abruptly. While moving, the brain collides with the skull. In a high-speed accident, the brain rotates inside the skull, thus damaging axons and blood vessels by stretching and tearing them. As a result, the damage can occur in a localized manner or spread throughout the brain, diffuse axonal injury. During an opened injury, the skull and other protective layers are penetrated and therefore exposed to air, for example, gunshot wounds. After an opened head injury, the damage is more localized. Depending on the destructive path of the invasive object, damage can be similar to a closed injury. Primary versus secondary injury. Primary brain injuries occur at the moment of impact and are irreversible. Therefore, the main focus during hospitalization and acute management is to prevent secondary brain injury and minimize further damage. Primary brain injuries include skull fractures, where there is a denting or breaking of the skull. The pieces of bone resulting from the lesion might cause injury to the brain. It is referred to as a depressed skull injury. Localized injuries, which can involve contusion or hemorrhages on the surface or within a layer of the brain. Diffusal axonal injuries, which are represented by the loss of consciousness and damage to the brain. These injuries cause the stretching of neuronal bodies and axons. This type of injury is difficult to diagnose using routine imagery like computed tomography. Secondary injuries usually appear a few days after the initial injury. They can be due to a lack of oxygen to the brain, which can result from low blood pressure or increased intracranial pressure from brain tissue swelling. Follow us to learn more about traumatic brain injury, its assessment, consequences, and treatment.